like a little 3 countdown, and it's like being on the top of the roller coaster.
It does.
And like it going chug, 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 chug. It's Christabel and Arafia. Oh my God, we say that in sync because we're just amazingly in sync with each other. So this is part 6 of the pregnancy journey.
Yes.
If you missed last week, we talked about the third trimester. Baby was getting big like a watermelon, I think we said. You've got a watermelon in your belly.
And you also recommended that the tea.
That was the part before Narafia. Has anyone actually tried that? Okay, firstly, is anybody watching our videos? Shout out if you are. Just let us know that there's like one person. Yeah. And if you are watching them, did you try my ginger cordial?
Yeah.
And was it any good? Because if it is, I might be able to get famous and rich off it, right?
Yeah, you could be like one of those new chefs, like the women who does the cooking stuff.
I could be like Nigella. Yeah. Oh my God, I don't want to be Nigella. Though she did go through a little drug phase, so maybe I don't want to. I'll be like the clean version of Nigella.
To that extent, yeah.
And I won't be in my practice because I'll be famous for making ginger cordial.
No, that's right.
Oh my God, let us know. Was it tasty? So as usual, just a little quick medical disclaimer.
Yeah.
We are just giving you general advice. It is not meant to be replacing your doctors or midwives or nurses or healthcare professionals.
Yeah.
So take the advice with a pinch of salt and make sure it applies to you and your families.
Yeah.
So today we're going to be talking about labour because I asked Narafia a really stupid question, but it's the stupid questions that are the best ones because you guys are probably at home. Maybe you're pregnant.
Yeah.
And I said, well, how do you know? You need to go to the hospital. How do you know labour started?
Mm-hmm.
I mean, we just see TV shows and, people leak some fluid and that's that.
That's
and
right.
then a baby pops out.
That's right.
But I figured there might be something else there. So I asked the stupid question. You guys can thank me later. How do we know? We're in labour.
Yeah, so usually, so if you've never experienced labour before, so your waters can break.
Yeah.
But that's not a necessary thing. And just because your waters break, don't assume like, in the movies, waters break. Gosh,
baby's coming.
Baby's coming.
Yeah.
It doesn't happen like that. So waters break. Prior to that, Christabel, you can start losing your mucus plug.
Okay.
Yep. So that's like a little plug of mucus that is in front of the cervix, and it forms a seal, it's a protective seal. Yeah.
So what would women see for that?
So they could be wiping themselves, and they'll just see like this snotty mass.
So you could miss it.
You could miss it,
and that's
like,
okay.
You can have a shower, and then it's fine.
Yeah,
so it's just one of the signs.
Yeah.
You could get diarrhea.
Oh, okay.
Yeah. So that's just like your body clearing the way. Yeah.
Mm-hmm.
Obviously, if it's severe, like you need to kind of differentiate whether like you ate like a dodgy curry or something.
Yeah.
Right.
Yeah. If Christabel was cooking, probably the last time.
Yeah.
No, I tell a lie. I'm really good.
So, but you can get diarrhea.
Yeah.
You can get like nauseous, and you can like do a bit of vomiting and that anyway. Some women also experience what they call the nesting phase, and so like maybe the week before, a few days before, they get like a cleaning frenzy.
Oh. Okay.
Yeah. Yes.
Keep pregnant women around your house.
They
might come in handy.
Come in handy.
Okay.
And then your contractions. So your contractions will start, and usually they come in waves. So it's not like they come in, it's just going to be like super painful and, just like that. So usually you might start with the odd cramping, and then it starts to build, and then it'll just kind of come and go. Mm-hmm. So normally, if they are coming regularly and they are lasting anywhere up to a minute, and they've been going on for at least 2 or 3 hours, then it's a pretty safe bet that your labour started.
Okay.
Yeah. But
so up to a minute between contractions and at least 2 or 3 hours prior.
Yeah, the contractions lasting up to a minute. But usually they sort of start off like, you might have like a 15-second one, and then it's a 30-second one.
Okay.
Yeah.
Okay.
And they come. So what most midwives will tell you is if you have regular contractions, so they're coming at least 3 to 4 contractions in a 10-minute period, lasting anywhere up to a minute, and you've been having them for like 2 hours, yeah. And then, try things. So if you ring up the hospital, right, because in the front of the book, so everyone should have one of these little books here.
Yeah, depending on where you are. If you're in Perth, you'll have one of these.
Oh, that's really bright, isn't it?
Yeah, it's like how we look white.
I know.
Right, it's a pregnancy handheld record. It's your Bible when
that's
you're pregnant.
Right. And in the front page up here, which you can't really see properly, there's some things that can occur of when you should be ringing the hospital.
Yeah, which we'll talk about a bit later.
That's right.
So when you call up the hospital, when do you need to go to the hospital? If you're having a hospital birth.
If you're having a hospital birth, yeah. So generally, unless so if you've got all the right signs, so you're contracting regularly, you've got no other risk factors, so they could be like if you've got Group B strep, so there's a protocol for that. If your waters break beforehand, then making sure that the colours are clear. But like you should be ringing the hospital anyway to say, hey, I'm in labour, and they'll want to check off a few things with you.
Okay. And so as soon as you realise you're in labour, so you're getting those contractions, you ring the hospital.
Yes.
Yeah.
And then usually you'll have a midwife talk to you and ask you a few questions around your Group B strep status, if your waters are broken, if they're clear, all that sort of stuff. So then the midwife will talk you through it? Yeah, that's right. And then if everything's good and you don't need any pain relief, then they'll say, hey, stay home.
Okay.
Yeah. Stay home until you get to the point where like the contractions are really amped up and you need pain relief, or you just feel like I need to go to the hospital now.
Okay. Yeah. Okay. Yeah. So how long can it be between those stages? So it depends on if it's your first baby. Yeah. Because if it's your first baby, it can go on for what?
Well, exactly. You could have days of like they call it spurious labour, where you're having these regular or irregular contractions, but they're not really doing anything. They're not taking you into that next stage of labour, so to speak. Yeah.
So, you might have some time. Yes. So you don't have to be rushing. It's not like the movies where you're going to have a baby on the side of the road.
That's right. Yeah.
And some random is just going to come all up in your grill.
Well, just some women, if they're like, they're really relaxed and it happens really quickly, you could have a baby by the side of the road. Or in the car,
your partner or your support person or your mum or whatever, it's a good job that if they're around to be ringing the hospital maybe to help that if you're going to have a support person helping you, you tell them when they need to ring the hospital.
Yes.
Which is when you've had up to a minute of contractions.
Yeah, regular contractions, at least going in for 2 to 3 hours, and you've done things like you've gone in the shower, you've gone in the bath, and they're just not doing it for you anymore.
Yeah.
So it's a great idea to do some classes.
Yeah.
Yep, active birth classes.
So you can look at what you can be doing while you're in labour to hold off needing the painkillers and stuff.
Absolutely, yeah. Because if you go in, so basically every time you go into the hospital, the midwives will assess you, so that's an internal examination. And so if you're only early, and when I say early, even though your contractions are regular, but you're only, say, 2 to 3 centimetres, you've got no other risk factors that warrant them saying, okay, we've got to keep you in and, do other stuff to you.
You'll just be sent home, won't you?
You'll be sent home, and then that can be a bit... Yeah.
So it's probably better to be in your own home environment as long as you can.
As long as you can.
So that's the thing, is to do some birth classes so you know tools and tips and tricks that your partners or support people can help you with.
Yeah, very important.
But if you're not sure, always call the hospital
yes.
or your midwife
yes.
because they are a fountain of knowledge and they will help you. So even if you forget all of this and you're like, I don't know if it's 10 seconds, 20 seconds, 3 minutes, 4 hours, doesn't really matter. Just call up.
Yeah.
And then just a couple of red flags. Things that you must or really should call a midwife or doctor about.
Mm-hmm.
So if you're getting bleeding at any stage, if your waters break, it should be a clear liquid. So if anything comes out that isn't clear, so if it's green, sometimes it means the baby's had a poo. But you would still need to get checked out. So give your hospital a ring. And if you're feeling unwell at any point, so feverish, really nauseous, and of course that really bad sort of diarrhea type bug symptoms, so nausea, vomiting and diarrhea, probably best just to touch base with a midwife or a doctor.
Absolutely.
So that's it really.
Sorry, any signs of
adding to the list, not that we do that.
Right. Reduced fetal movement, so that's one of the other things the midwives will ask, is the baby moving normally?
Because remember we talked about this a few videos ago, finding your baby's tune, like your baby's in a dance soul. That's right. Like are they a jiver, are they a slow dancer? Oh hello, I love a bit of reggae. So you're going to find out baby's tune, and so if baby's tune goes a bit off, you can go, hang on, this isn't right for my baby.
That's right.
Or babies, because you might be having multiple. So is that it for today's video?
I think so,
yeah. This might be the shortest video we've ever done, and we say that every time and it's still like 10 minutes.
And we do not purposely colour coordinate.
I know, we should swap. It's because we're so zen. We speak like each other, we look like each other, we dress like each other. It's all a good duo act. So next week we're going to be talking a little bit about options for managing pain during labour. So we're going to talk about things you can be doing at home, a little bit of the Rebozo and stuff.
Yeah.
And then some of the stuff that the hospital can offer you when you're coming up with your birth plan.
Yes. And so, I think we might recruit Cheryl.
Shazza yeah, we did. If you follow us on Facebook, we did do a really hysterical video on Facebook with the Rebozo, which you'll have to tune in for next week. We're not going to give it away.
No.
So tune in next week, and we'll talk to you a bit more about pain management and strategies during labour. Yes, that's it from Narafia and Christabel.
See ya.
Have a lovely night. Bye, guys.
Bye.